Well, I'm going to talk about the Philippines hospital medical system here. I am not an expert, but I have more experience than most people. So I did learn something now. First of all, it is impossible that the Philippine system is better than the United States. I knew that without even going to the hospital. But my thought was for a relatively simple operation, and hernia operations are simple, uncomplicated. It doesn't take a great surgeon to do it. Average surgeon can do it. I figured it was okay to stay here. But if I had a complicated operation, heart, brain aneurysm, I would have gone back to the United States. And if I get cancer, I will go back to the United States to get the latest treatment, whatever that is at the time. But for more routine things, there's no problem here for doing those. Though the system is different and a lot cheaper, at least 1/5. I mean, office calls are like 400 to 500 pesos to see a doctor. So that's like $12 max to see a doctor. Are you kidding me? It's over 100 now, isn't it, in the United States? I think it was 80 the last time I went to a doctor and paid for the visit. So I think it's up there 100, I think. Substantially more. Now, you have to do a lot of things on your own here. The doctor told me the test I needed to do and where to go, and I had to do a lot of running around to get those tests. And you carry your own medical records and tests with you as you go around. The tests are relatively cheap. I did a whole bunch of blood tests for $30-something. The heart echo test was the most expensive. Let me see, that was like $70, I think. And that included a consultation with the doctor afterwards, and then she get thumbs up or down for the operation. So I'm going to say $150 for all the testing, which is very, very reasonable, of course. And the big difference in the hospital is that they don't have nurses' aides. They've got nurses and doctors and people who clean the room. A team comes in, they spend like 5 minutes. I don't know, I don't think the room was super clean, but oh well. But they have no certified nurses' assistants, CNAs, as they are called in the United States. You're expected to take your own caregiver. So if you need somebody to help feed you, help bathe you, help dress you, whatever it is, you got to have your own caregiver. And there's a bed for them in your room, and you can buy food there at the hospital, or they can go out and get food for you. And that's probably a good plan here in the Philippines, actually, because most people would have their own caregiver anyway, even if they had CNAs, because everybody here has got family that's not working, sisters, brothers, parents. A big part of the population is not working in a full-time job, so they can very easily come to the hospital and help. And it's that kind of society here where families do help each other out quite a bit. So, and it's a good plan, actually, if you have a caregiver. But if you don't, if you're a foreigner and you don't have one, you can hire caregivers all day long for cheap. A lot of people will work for like 500 pesos a day. If you need around the clock, maybe 1,000 a day, $24. Give them a tip, $30 a day if you needed one. I did have a caregiver, my girlfriend. That was tremendous to have her there. Let me tell you, she ramrods everything and goes and gets the nurse when I needed it because there's no call button. You go, why would you have a call button? You got somebody there to go tell the nurse. I mean, it's a different system, but it all worked out for me in the end. Any hospital you go to, there's frustrations. Any medical system, I've experienced that in the United States. I had my complaints about the hospitals and doctors that Dad was in and the doctors he had. And the main problem in the United States is the big money, the charging for Medicare for services they didn't do, and outrageous charges. It's just ridiculous in the United States. But of course that happens because of insurance paying for everything. There is insurance here. I could get Phil Health, but it's completely in reverse here. Phil Health would cover 20%. I would have had to pay 80 if I had that insurance. Of course, in the United States, it's normally the opposite. The insurance covers 80 and you cover 20. That's the way Medicare is if you don't have extended, extra coverage. But anyway, so the bottom line is I'm glad I stayed here to have the operation. It was fine for being a simple, not for recovery. I'm still hurting, but for a simple sort of thing, I would do it again here in the Philippines.